the 17th European Patient Rights Day, CIT Adinanzativa, through its European branch, the Active Citizenship Network, ACN, threw the spotlight on Advanced Therapy Medicinal Products, or ATMPs, at an event held at the European Parliament. ATMPs target genes, tissue and cells. They provide groundbreaking innovation for the treatment and prevention of a range of long-term genetic or oncological diseases such as cancer.
ATMPs are innovative and disruptive therapies, but those who are using these therapies cannot be exposed to a situation of uncertainty. Surely the ATMPs have significant costs, but for this reason it is necessary a change to classify this cost not as a cost but as an investment.
For MEP Tomislav Sokol, one way to unstick innovation: reform of EU pharma legislation.
I'm glad that the European Commission has come up with a new proposal on new pharma legislation today, and I hope that this proposal will be improved in a way that it really facilitates development of new medical technologies, that it provides additional incentives for investments in Europe, and without that our healthcare systems cannot go forward.
50% of rare diseases affect children. For Attila, whose own daughter suffers from Turner syndrome, a female-only disorder, early diagnosis is key.
Physicians don't know all the necessary information to have a diagnosis, and all the rare diseases are different from each other, and even they can be combined. The symptoms is not always clear and cannot identify the disease itself.
One way to improve access to ATMPs: active citizenship.
Well, I think that the role of patient is very essential in managing healthcare, but overall in managing and promoting health. So patient literacy, patient awareness, patient roles, and the role of network around patients.
But for Italian socialist MEP Brando Benefei, there was also a role for the institution to play in public health policy.
It's not easy as a policymaker. I see all the difficulties, not just in the specific of the developments and the usage of and the accessibility of new treatments, but also on the social costs, the need for more efficiency, for integrating new technologies, like I mentioned earlier. But together we can face these challenges.
Here at the European Parliament, it was clear there is an added value that ATMPs can provide to patients suffering with rare disease. But even if the needle can be pushed on investing in research and development, on payment mechanisms, the problem is that across EU member states, healthcare systems simply aren't prepped for the changes that would need to be made to ensure that patients across the EU have equitable access to life-changing ATMPs.